everyone, welcome to Healthy Kids Corner with me, Dr. Brooks. Today we're going to talk about a topic that many of you are struggling with, which is ADD or ADHD. There is an exorbitant amount of children being diagnosed with ADD and ADHD, and some, if not most, are misdiagnosed. I know a lot of you are in the school systems, teachers saying, I think your child has ADD, or they need to get assessed for ADD, and you just really don't know what to do in seeking some guidance and some help. Some parents are given an ultimatum, and that is medicate your child or don't come back to school. And this can be a very, very difficult thing to come across when parents feel like they're kind of stuck between a rock and a hard place, which is like a lot of you, right? So it's important for parents and teachers to know that there are effective, safe, and natural options at work. So some of the natural options include diet changes, nutritional supplementation, chiropractic care, craniosacral therapy, family counseling, and of course social skills. So some, if not all of these, you can find on our website and read a little bit more about at mychildwellness.com. But let's dive into some of the qualifications for ADD or ADHD. I think some are misdiagnosed with ADD and ADHD, and they actually have things like Asperger's or autism, sensory processing disorders, or learning disabilities. These can also be a factor in having that diagnosis. Bad behavior is just a symptom. It's just a symptom of something different, right? Just something bigger going on that we need to figure out. So there's subtypes of ADD and ADHD that I want to go through so you can kind of figure out, where am I? Where's my kid? And you can actually view these on our website under the ADD ADHD page, again at mychildwellness.com. So I know I'm going to fly through them a little bit quickly, but you can always go back to them on our website, and I'll leave the link down below. So anyway, when a diagnostician meets with your child, they usually categorize them into one of four categories. The first is the inattentive subtype. So that's a child that's not good with details, has difficulty sustaining attention, frequently fails to listen carefully or finish listening at all, doesn't follow through on tasks as well, has to be, redirected and things a lot. Also, they tend not to be good at being organized. They dislike sustaining mental effort. So unless it's, a video game or something like that, they're really not interested in, because we all know that they're interested in those. But if they really have to sit down and do homework, they really aren't good at sustaining a long time doing homework, or any kind of effort, I should say. They often lose things. They're easily distracted and forgetful. So that's our inattentive type. The next one is our hyperactive/impulsive subtype. This subtype, they fidget when they're in their seats, which is what I'm doing right now. I'm kind of laughing at myself. They fidget when they're seated, or they won't. I do have kids that will just get up and walk around the room. They'll just kind of take off. So that's that kiddo. Often leaves his or her seat in the classroom, right? We just said that. They're restless and they run around excessively. So not only in class, but just at home, they can't seem to sit down. I have lots of parents that say, we can't get them to sit down for dinner at night. So this would be the kiddo that I'm talking about. Doesn't like quiet activities. Just seems to want to be kind of in the mix and running around and being rambunctious. Often on the go, if you will, has a hard time, again, just sitting down. Blurts out answers after questions, or before you're even done with a sentence, they just blurt things out kind of inappropriately. Has difficulty waiting their turn, which can be difficult for many kids, but this particular child is too impulsive and hyperactive to wait their turn. Interrupts conversations and games. So that's the hyperactive-impulsive subtype. The next one is the ADHD-NOS, which means not otherwise specified. It's kind of the catch-all. The catch-all of, we don't really know, but we have to make a subtype for them because they don't fit into any other box, right? This is defined by a child or individual who demonstrates some characteristics, but an insufficient number of symptoms to reach a full diagnosis. So they may say they have some, but not all, and we think they're maybe headed down that road, so we're going to go ahead and give you the ADHD-NOS diagnosis. These symptoms can really interrupt everyday life for them, which can be really difficult not only for you at home, but for your teachers and therapists and aftercare programs. And the last type I want to talk about is ADHD combined subtype. So this is an individual that meets both sets of the attention and the hyperactivity impulsive criteria. So they are a combined subtype, right? So more importantly, what can parents do if they're up against this diagnosis or if it's being kind of thrown out in school and becoming really, really difficult? There are so many things you can do for a child other than medicating. If medication is not what you want to do, it's not going to be a quick fix, right? Medication's a quick fix, but it's usually not a prolonged fix. What you can do to really fix the problem is examine what's going on in the inside of a kiddo's body. For us, for me in my practice, I do lab testing. Dietary modifications can be huge with children with ADD and ADHD. Really looking at their nutritional deficiencies, what they are, and filling in those gaps for them so that their body can function better. Nutritional counseling is a big one that I do a lot with kids with ADD and ADHD. So really helping the parents change the diet and modify it in a way that the child can comply with it. It always gets harder when they go to school and they have those really amazingly unhealthy options at the school cafeteria that they're dying for pizza Monday and ice cream Friday, which just makes me cringe. So anyway, it can be really, really difficult. But a lot of times if a kid is feeling better, they will comply with the diet changes. You would be very, very surprised at how much compliance I get with kids in general. Of course, lab testing and evaluation, super important. You can't fix something you don't know is wrong, right? Or you might not know it's going on and it's actually the issue, not just the nutrient deficiency. So make sure your doctor does some really thorough testing. I would suggest doing urine testing, stool testing, and blood work just as a starting point, just to see what you're working with. The other thing is chiropractic care can be really, really helpful. I also use craniosacral therapy in my practice, which is a very, very light, gentle therapy that complements kind of the bone osseous adjustments that chiropractic do. Craniosacral works on the other half of the soft tissue, so it is a wonderful, wonderful way to calm the nervous system down, which obviously will calm behavior down with some children. Resolution of their GI and digestive issues. A lot of these kids, behavior is the symptom that's slapping you in the face, but it's not the only issue going on. So if we find out what those are through testing and address those, your child will see some results if that is their problem. Obviously, there's natural options for behavior improvement. There's great supplementation out there that can help a child with ADD and ADHD. So whether they're impulsive or hyperactive, there are some really amazing supplements that I call kind of the natural, psychotropic drugs. So I always tell families, really look into a functional approach, finding a functional medicine doctor like myself to really help you, because when you find out what's going on in the inside of their body and fix those things like therapeutic interventions can really go a long way at that point if they haven't worked for you thus far. And then, of course, finding the root cause. That's what it's all about. That's what my practice is all about, and that's what I think parents should really focus on. You can go ahead and blurt out the symptoms with medication. You can, get rid of it, kind of the slapping in your face 24 hours a day, but it's really not going to fix the problem. If anything, you will be creating a bigger problem to fix later. So always something to consider. With my parents, I'll often tell them, when those medications are prescribed, they're not prescribed after doing proper lab testing. So, I have a background with nursing and my nursing degree. So a lot of times I will help parents, if medication's really something they come in here and they really want to do, we'll do proper testing to try to help their pediatrician or psychiatrist recommend a medication that fits with their child. There are also genetic factors to think about. There's some really great genetic testing on the market that can help figure out what medication classes that your child may not do well with. So that is really something to look into and to think about, because our bodies are not all designed the same. They're not all designed to take medications the same. So it's definitely something you want to think about if it's going to be your long-term solution. So if your child has any of these symptoms, we urge you to call our office, of course, or call somebody else in your area that does functional medicine. Find a chiropractor. I'll link that below so you can find a chiropractor in your area as well. So if you want some more information or more education, you can join us on our monthly webinars. I do parent webinars and clinician webinars once a month. You can find out what we're doing in the next couple of months at dramberbrooks.com. We also have previously recorded webinars there too, so you can obviously listen to those whenever you want. We're also on Facebook at Whole Child Wellness, so I do post lots there, so find us there and like us, and then on Twitter at Whole Child, the number 4U. So I think that's about it. You can check out our website at mychildwellness.com again for these subtypes I have listed on the ADHD and ADD page under education. So you can check them out. We do have some research studies on diet changes and things too that may help. So if you find that you need us, give us a call. And then of course I'll link some links down below to help you out. I think that's it. If you liked the video, give me a thumbs up and of course share it with your family and friends. Thank you so much for watching. Have a fantastic day.